Yes, please come in, have a seat. Hello, hello, welcome to my ASMR clinic. Name's Dr. Artie. Nice to meet you. So, what brings you in today in such a rainy day? You have an appointment, okay? May I know your full name? You look familiar to me. You've been here before, yes, definitely. And I see in my records, today is your full detailed physical examination. Am I right? Perfect, perfect. So since the last exam, has everything changed? I mean about your health condition? Do you have any concerns about your health in general? How well do you sleep at night? How many hours? Approximately. Okay, that's a nice result. So, do you usually wake up during your night sleep? And if you do, how many times? And what's the reason for this? Okay, yeah. I see. So, how well do you usually fall asleep? Quickly, or you prefer to watch something? You... Okay, that's a quite standard time, yes. Do you watch ASMR before your night sleep? You do? Okay. That's a good habit, just do not watch it too long. Yes. Just 1-2 videos. One better. Yeah. Okay, so any other concerns, for example, about your heart, lungs, your vitals overall, maybe your hearing, your eyesight? Any problems with your vision? Blurry? Double vision? How many fingers? Yes, I've done this 1,000,000 times. 2 fingers, okay. No redness, dryness. No, let's say, desaturation. How well is saturation? You don't know, okay? So, any blind spots, anything unusual in your eyesight, maybe black spots, maybe white spots, anything like so? No? Okay, good. What about your hearing? Is everything fine? No white noise? No, let's say, strange noises, like something's pumping inside your ears, like so? No? Good. So, do you know your common, let's say, blood pressure? What is the average numbers? Okay, so we'll figure it out today. And I suppose that is it. Yeah, we move on to the actual exam. I'll start with your vitals, your pulse, blood pressure, heart, lungs, body temperature. Then we move on to your ears and hearing, then nose, throat, and lymph nodes, and then eyes, and etc. Okay? Before I put my gloves on, may I have your arm? Well, actually, it doesn't matter. My hands are clean, absolutely clean. I need to count your pulse. I have your wrist. Yeah, thank you. Now let's be quiet for a minute, okay? And about 75. Yes, 74, 75. I've confused a couple of times. That's a very good result. Don't worry. And now I put my gloves on. May I ask you to, yes, to lift up or just your top? I need your lungs to be checked and your heart as well. So for that, I'll put my gloves on. Yes, that's enough. Thank you very much. And let's start the exam. I'll warm this thing up for you just a little bit. Is it warm enough? Yes, so hold still, okay? Don't move, just breathe normally for me. Breathe in, breathe out. Breathe in and breathe out. Apologize if you hear some noises. That's the... Yes, breathe in, breathe out. The office right next to us. Yeah, sorry. Okay. Make a nice deep breath in. Nice and deep, and hold it for a second. Keep holding it, and now let it out. And one more time, make a nice deep breath in, and now let it out. For another time, one more time, sorry. Make a nice deep breath in. Now hold it, and exhale. And now from your back, yes, keep doing the same. Just breathe in, breathe out. Breathe in and breathe out. And now make a nice deep breath in. Hold it. Keep holding it. And now let it out. And this side again. Keep breathing normally for me. And now make a nice deep breath in. Nice and long. That's it. Hold it. And let it out. So, your heart is absolutely okay. Beats normally. Like so. Your lungs are clean. No sounds that shouldn't be there. So we move on to your blood pressure. I ask you to roll up your sleeve. That doesn't matter, but this hand is okay. So now I'll take this sleeve and put it on your arm. Yes. Put this thing under the sleeve. Is everything fine? So when I'll start pumping up quiet for a second. Yes, that's it. Okay. Your blood pressure is okay, 120 to 75. Usually it has to be about 80, but 75 is a-okay. So we move on to your hearing or your throat, nose, lymph nodes. Which one do you prefer first? Ears. Okay. May I ask you just to live a little bit closer, slightly closer? That's it to me. Yes, my hands aren't so long, unfortunately. Yeah, I'll start palpating your ears, if you don't mind. Okay? Okay, good. So, usually it is absolutely painless, but do you know what's coming next? What's the next part? Yes, but if you feel any kind of pain, just let me know. Pain or anything unusual that you shouldn't feel when I'm touching your ears. Yes, I'm looking for any bumps or lumps or anything unusual inside your auricles. So, you have piercing earrings? Okay, yeah, I see. Little bumps here and there. That's the common thing about earrings. Okay. So, any problems with your earrings and piercing, inflammations, pain, dry skin, blood? No? That's good. How long did you make it? Oh, that's quite a lot ago. Okay. Yeah, quite long ago. So, when I'm pressing here, do you feel pain or discomfort? No? Okay. So I'll palpate your ears thoroughly, and then I'll check your inner ear. In other words, your ear canals. Yes, with the otoscope. This is going to be ticklish and partly unpleasant, but you've got this. I promise. Alright, what about here when I'm rubbing my fingers here? What actually do you feel? Nothing but rubbing. Okay. And what about now? No pain, no discomfort. Good to know. So let me see closer. And I'm looking for any sort of need a light. Okay. Going to palpate your left ear and then your right ear. Now I need to see if there are any inflammations or some signs of infection or anything unusual like flaked skin or dryness. Yeah. So your skin looks healthy. No sign of inflammations. Good. And now your right ear. We're doing this same, just examining it thoroughly with the light and through the lens. Yes. And let's see what we've got here. Just some healthy skin. Yeah, that's good. No bumps, no redness, no sign of inflammations. That is good. That is good. And that's it. Now I'll grab my otoscope. And what I'm going to do now, I'm going to pull your auricle back, pull it back, and stick the otoscope inside of your ear canal. This is going to be ticklish, as I've said, but if you feel pain, discomfort, let me know, okay? So I'm going to pull it back and stick it inside to see if there's anything unusual, any kind of inflammation, any earwax buildup. Okay. Yes, keep your head still for me. Thank you very much. Yes, ticklish, I know, but we need to examine everything thoroughly. Okay, yes. Keep sitting nice and straight. Do not move your head. Yes, I'm almost done with the left ear. Just need to see just a little bit deeper. If you feel discomfort, I am sorry, but there is no other way to examine your inner ear. Yes, that's it. That's it. And just a little bit of earwax, but nothing serious. We don't need to clean your ears today. We may leave it for the next exam, where you may clean it at home. Yes, how are you feeling? Okay, now we do the same. Going to pull your right ear, your right auricle, and stick it inside. Okay. Once here, just a little bit of earwax as well, but again, nothing serious. Small pieces, small flakes, I would even say, but nothing to worry about. And I see no redness. That means no sign of inflammations here. Okay, and do you know what I forgot to do? You don't? Okay, I'll tell you after the exam. So I just need to see a little bit deeper. This is going to be unpleasant. Sorry. Yes, that's it. And yeah, that's it. I forgot, completely forgot to take your body temperature. Yes. I completely forgot to take your body temperature. May I ask you to open your mouth, stick out your tongue, put it under the tongue. Yes. Close your mouth. We just wait for a beep. Yes, and if it beeps, everything is taken. So, your ears are absolutely healthy. As I've said, no sign of infections. If you have high temperature, that potentially could be, that's it. Your body temperature is okay. 36.6 Celsius. Yes, we use Celsius here. Why not? That's a perfect body temperature. That means no sign of inflammations. Yeah, so there is no infection. inside of your organism. So, where was I? Your ears. Yeah, everything is good, healthy. The good color, I mean, your ear canal has a good, nice pink color. No redness, just a little bit of earwax, but that's completely fine. So, we move on to the next part of the examination, your lymph nodes. So again, may I ask you just to, yeah, thank you very much. We start with your neck and ears, lymph nodes. I'm gonna be palpating them again. In other words, I'm gonna be brushing my fingers. Yes, usually it's absolutely painless, but again, if you feel anything uncomfortable, just let me know. Yeah, your lymph nodes are fine. No inflammation, just a standard size. Okay, we move on to your chest. This is gonna be ticklish just a little bit, but chest lymph nodes are good. May I ask you just to lift up your arms just a little bit? I need to palpate the lymph nodes under your armpits. Yes, this is going to be ticklish. Yes, you got this. You got this. That's it. Put it down. So your lymph nodes are fine. And we move on to your throat. For this, I'm gonna need this wooden stick. It's disposable. I forgot the right word for this thing. Correct me if I'm wrong. May I ask you to open your mouth and stick out your tongue for me as far as you can. And I'm gonna be shining these bright lights. I'm sorry if it's too bright for your eyes. Everything looks healthy. May I ask you to say nice and long for me. That's it. Swallow if you need it. And do the same again. Okay, so your throat looks healthy. No redness. Can you say for the last time? Need to make sure that everything is okay. Yeah. Swallow if you need. Everything looks healthy. No redness. No sign of inflammations. That's good. Now we check your nose. For that, I'm gonna need the otoscope again, but with another tip. Can you just slightly move your head up? I'm going to stick the otoscope inside of your nostril. Keep your head very still, do not move. I'll examine your nostrils one by one, just like we did with your ear canals, but this is much quicker. Okay, because usually if you have a healthy throat, you also have a healthy nose, because they are very, very close to each other. Yes, and they connected very tightly. Okay, so breathe normally for me. Yes, a nice, good nostrils with no sign of infection. That is good. Now we do a couple of quick hearing tests. Yes, we're back to your ears. I want you to tell me if you hear the vibration. Can you hear it? Yeah, and what was the side? Left or right? Left. Can you hear it here? Mainly your right. Perfect. Now I want you to not look at the tuning fork and point me the direction of the sound source, the direction of vibration, just with your finger, left or right. Okay? Good. Do not look. Just listen. Yes. 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 And yes. Perfect. And what about now? Yes. Left, right. Perfect. The next test is going to be the whispering test. We'll do it quick. Yes, because everything is fine with your ears. And I suppose there's nothing wrong with your hearing, okay? Oh well, can you hear me? Okay, so there will be 3 numbers for each side. I want you to listen to me very, very closely. Memorize the numbers and then repeat them back, okay? Okay, 3, 5, 8. Got them. 3, 5, 8. Perfect. 10, 9, 15. Got them. 10, 9, 15. Perfect. 20, 88, 30. One more time. I'll change the numbers, okay? Okay. 22, 87, and 49. 89 and 49. Yes. Okay. So, how well can you hear me? Here. Okay. So the numbers are 2, 7, 7, and 19. 2, 7, 7, and 19. Yeah, there were 4 numbers. Well, just in case, why not? Okay, so 1, 49, 94. 94, perfect. And for the last time, 99, 12, 24. And yes, correct. That's a nice result. Now I want to check your sense of smell because we are checking your ears, nose, and throat. Why not? So here I've got a cotton pot and some samples. They have different colors. I'm gonna be spraying it on the cotton pot, and I want you. This one is green. I want you to smell it, just breathing normally with your both nostrils. This is not a olfactory nerve examination, which is part of a cranial nerve examination, but I just want you to recognize the smell and what is this? And take your time. What can it be? And this is grass. Yes, green grass. Perfect. The next sample is, let's say, yellow, orange, something between. Can you smell it? And can you recognize the smell? What can it be? Citrus and what kind? Orange, perfect. Alright, the next one is kind of red. Yes, remember? Okay. Breathe in and breathe out. And what can it be? What kind of smell is that? Yes, this is a Berry, but what kind of? Raspberry, perfect. And the last one is blue. Take your time, just breathe normally. Can you smell it? And what kind of smell is that? And something's fresh, and but not sea, just a little bit bigger. The ocean breeze, yes, perfect. And now the test for your sense of taste. Yes, there will be 3 samples. I want you to taste them. Gonna be dropping a couple of drops on your tongue. Stick out your tongue for me. Drop, drop. Okay. And now stick the tongue back and taste like this. Yes. And I want you to tell me, what is this? Yes, this is definitely something sweet. Yes, maybe, but nice round berries. Grape, yes. The next one is green. No, it's not grass. Stick out the tongue. Drop, drop, drop. Yes, stick it back and taste. What can it be? Yes, and green apple, perfect. The last sample for you today. You like this test? Yeah, stick out the tongue. Drop, drop, drop. And stick it back and taste. Take your time. What's this? Orange again, yeah. And finally, in the end, we move on to your eyes. Yes, I want you to keep your head very still. Yes, I'm gonna be shining these lights in your eyes. This is actually kinda bright, but you got this. This won't damage your eyes. Just want to examine your eyeballs to see if there are any redness or any other colors that shouldn't be here, like yellow, for example. Yes, your eyeballs could be yellow with some disease. Yes, but your eyeballs are white with no sign of dryness or infections. That is good. I'm going to pull your eyelids down. Yes, no redness. So I suppose your eyeballs in a very good condition. Yes. Now I need to check your pupil reflex. Do the bright light. Yes, just do not look at the light if you can. Just look at my hand if you want, or just look at me. You got blinded. Okay, let's try it this way. Okay, I'll cover one of your eyes with my palm, and I'm going to slowly bring the light in your field of vision. This is not the eye exam, so we just need to make sure that everything is okay, just in general. Yes. Okay, look at me. Do not look at the lights. Everything looks good. We'll do a couple of tests for your eyesight. No, the eye chart is for the actual eye exam. We just do a simple color blindness test. And a couple of tests for your peripheral vision. Ask you to look up for me. Yes, look up. Now look down. Look at me. Okay. Look to your right. Okay. And now to your left. Look at me again. Okay. And look up. Look at me. Can you follow the light with your eyes only? Please do not move your head. Just follow the light. Is it bright enough? Okay, let's try another one. Isn't this better? Better, okay, so just follow the light with your eyes only. Do not move your head, okay? Just hold very, very still and follow the light with your eyes. Okay, let's try it a little bit closer when it was before. Just follow the light with your eyes wherever it moves. Okay, wherever it goes. Okay. And here and to the center. Down and up and to the center. Diagonally down. Diagonally up to the center. Diagonally up. Diagonally down to the center. And to your right. To your left. Up here. Down here. And the center. That's good. Now I want you to focus on the tip of my nose. I'm gonna be rubbing my fingers in front of you, and I want you to point me the direction of the movement. Yes, just focus here. Do not look at my hands. Prepare your fingers like so, or with one hand. Okay, look here. And point me if you see the movement. Yes. Yes. Don't look at my hands. Just look at my nose. Okay, keep looking here. I'm gonna be moving my fingers out. And I want you to tell me when you cannot see the fingers at all. Look here. Can you see the fingers with your peripheral vision? Perfect. Keep looking at my nose and just let me know when you do not see. Keep looking here. Can you see my fingers again? Perfect. And both are gone. Keep looking here. Can you see the fingers? They are gone. Keep looking at my nose. Okay, keep looking here for the last time. Can you see them? Let me know when they are gone. That's good. Now we'll perform a simple color blindness test. Now we don't need some pictures. We just use a simple highlighter. Yes. Can you see it? And what color is this? Yes, yellow. See, this is actually very easy. What color is this? Let's call it pink. Yeah. What color is this? Wait. What color of the cap? Orange. Perfect. What color is this? White. And what color is this? Green. Okay. And what color is this? Blue. Perfect. So now I need this pink, let's call it pink highlighter. I want you to focus at my nose again. Can you see the highlighter with your peripheral vision. What kind of color is this? Pink. Can you see it here with your peripheral vision? Is this highlighter still pink? What about here? Do not look at the highlighter. Look at my nose. Pink as well. Sorry. Keep looking at my nose again. Can you see the highlighter with your peripheral vision? Keep looking at my nose. Is it pink? Yes. What about here? Keep looking at my nose. Is the highlighter pink? Yes. And what about here? Can you see it with your peripheral vision? Do not look at the highlighter. Look at my nose. Yes. And what color is this? Is this still pink? So was all the time color the same? The same color, the same saturation, pink, 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 here, here, here. Pink all the same, perfect. And the last test for today, keep looking at my nose again. I'm gonna be flushing the numbers with my fingers. I want you to tell me how many fingers do you actually see. Look at my nose. 1. With both hands. 2, 2, 3, 4, 8, 4, 2, 2, 1, 3, yes, 3, and for the last time, 6. That is good. So let's type down the results. This is it for today's examination. Overall, you are healthy. Yes. Let's type it. Everything is fine with your health. Everything in a very good condition. Your hearing is fine. It's very sharp. Your eyes are good, no redness. Body temperature is okay. Your blood pressure overall is okay. We unfortunately do not know your common blood pressure. I suggest you measuring it on a daily basis for a week or maybe 2. Do you have a thermometer at home? You can buy it. You can buy the mechanical one or electrical one. Yes. The manual one is the mechanical one, whatever, is slightly preciser than the electrical one. Yes. But for everyday home use, I suggest buying a electrical one. Yes, it's much easier to track your blood pressure. So you just take your blood pressure in the morning every day for a week or 2. Week is enough to slightly better because you'll get the more correct result. Yes. So yes, you just wake up, do a couple of stretches, couple of yawns, and then grab your thermometer and take your blood pressure. Yes, just in the morning after you woke up. And write down the result on the paper, in the notes on your smartphone. Smartphone is better because it's usually near with you. Yes. Overall, this is it for your health checkup. Your physical exam is over, and as I've said, you are healthy. There is no problem with your organs. Yes, and everything is good. May I ask you just to, rate my work with a like? You may look down there and you'll see the like button. Yes, can you hit it hard as hard as you can. Thank you very much. Consider subscribing to my smart clinic, and you may leave a comment about my work. Yes, you may read as well my work in the comment section. I'll be very grateful for this. So basically that's it. Thank you very much for your visit, and I'll see you on the next exam. Goodbye. Take care.